Hello everyone, my name is Keshav and today I'm presenting on dementia, which is non-communicable disease that mainly affects people later in life. So firstly, I will explain the name of the disease and it is pathophysiology. Dementia is a progressive neurological condition that affects the brain. It causes problem with memory, thinking, behavior, and the ability to carry out everyday activities. Dementia is not a normal part of aging, even though it is more common in older adults. The most common cause of dementia is Alzheimer's disease, followed by vascular dementia, which is linked to problems with blood flow to the brain. When the blood flow will be little bit stop or can cause any problem, in dementia, brain cells become damaged or die. This damage stops brain cells from communicating properly with each other. Over time, this leads to a gradual decline in cognitive function, meaning the person finds it harder to remember things, make decisions, and recognize people or places like he will forget some things. Next, I will explain why I chose this disease as a personal reflection. I chose dementia because it is a disease that only affects an individual but also has a strong impact on families, careers, and the wider community. I have seen how confusing and distressing dementia can be for older people, especially when they slowly lose their independence. In Australia, dementia is becoming more common because our population is aging. This makes it an important public health issue that will continue to grow in the future. Now, I will discuss the impacts of dementia at individual, local, national, and global levels. If we talk about the individual level, dementia affects a person's quality of life. People may experience memory loss, confusion, personality changes, and emotional distress. As the disease progresses, many people lose their ability to live independently and require full time care. At the local level, if we talk about dementia increases the demand on family careers, aged cares, facilities, community services, and local health systems. Careers often experience stress, burnout, and financial pressure. At the national level in Australia, if we talk about dementia, is one of the leading causes of death and disability. It places a large financial burden on the healthcare system due to hospital care, residential aged care, and support services. At the global level, dementia affects more than 55 million people worldwide. It creates major social and economical challenges for countries and also make sorry the challenges for countries, especially as life expectancies increases across the world. Next, I will explain the risk factors for dementia and prevention strategies. They are both non-modifiable and modifiable risk factors. Non-modifiable risk factors include age, genetics, and family history. These factors can't be changed. If we talk about modifiable factors, which include smoking, physical inactivity, unhealthy diet, high blood pressure, diabetes, obesity, and social isolation. Prevention strategy focus on reducing these modifiable risks. This includes doing regular physical activity, eating a healthy and balanced diet, managing chronic conditions like diabetes and hypertension, not smoking too much, or even do not smoke, never smoke, limiting alcohol and staying socially and mentally active throughout the life. Mean interact with people so you can feel better. These strategies may help reduce the risk or delay the onset of dementia. So finally, I will present the research question I would like to explore. If I had the opportunity, my research question will be how can early life and midlife intervention reduce the risk or delay the onset of dementia in older ages? The question is important because it focuses on prevention rather than treatment, which could improve quality of life and reduce the long-term burden of dementia on individuals and society. In conclusion, dementia is a serious non-communicable disease that affects people across the lifespan, particularly in older age people. Mean it affects older age people more than adults. Understanding its causes, impacts, and prevention strategies is essential for improving public health outcomes in Australia and globally. So, thank you for listening. So, this is the thing which I have to express, and also I'm having bit knowledge, so I've expressed to you. Thank you.